Today we're launching the Mental Health Commission's annual report on restrictive practice activity in mental health services. So just to put that in context, this is a report that we produce every year about how services introduce, use, manage restrictive practices in their mental health services. The 2022 report details a very positive trend in terms of restrictive practices in mental health services. And what that report is showing us that in 2022 there was a substantial reduction in a number of key restrictive practices such as physical restraint. We see this as a very positive development. We see this as something that mental health services should be commended for. It's in line with the Mental Health Commission's strategic objectives to have a human rights focus. And we really encourage mental health services to do more and to look at the restrictive practices in more detail to see how these activities and these restrictive practices can be reduced further. So the 2022 Restrictive Practices Report is one of a series of reports in recent years which demonstrates that there is a downward trend in the way mental health services are approaching restrictive practices such as physical restraint, seclusion and the use of mechanical restraint. This shows in the last 5 years that there is a downward trend in the overall number of these practices used, and it demonstrates that services are implementing practices, implementing controls and implementing oversight structures to reduce and where possible eliminate these kinds of restrictive practices from their service and from their service provision. And this is a very positive thing. This is something that the Mental Health Commission welcomes. So many people ask us if there will come a time when restrictive practices can be completely eliminated from mental health services. And what we say is that we need to be mindful of a human rights approach. We need to be mindful that services must be safe, and we need to be mindful that at times people can be acutely unwell. What we know from the research and from the evidence is that when staff are well trained, when physical environments are appropriately designed, when there are good policies in place, these practices reduce and they come down. There may always be situations where people are so acutely unwell that they present harm to themselves and we need to intervene. So in that context, it's likely that we'll always see some form of restrictive practice, but we always need to keep a focus on reducing and eliminating them altogether.